Hello, my name is Rebecca Aguayo, and this is my Prospectus PowerPoint. The title of my dissertation is A Qualitative Investigation of the Impact of Transitioning from 21 CFR 820 to ISO 13485. For today's agenda, we will be reviewing chapters 1 through 3. Chapter 1 will cover the background, statement of the research problem, purpose statement, research questions, and the significance of the problem. Chapter 2 will have a brief review of the literature, related theories and their theorists. Chapter 3 will include research design, population, sample, instrumentation, data collection and analysis, and limitations, including a conclusion. The bullet points I have listed in my slideshow will illustrate key elements of my dissertation. Chapter 1, we will begin with background. This section outlines the regulatory landscape for U.S. medical device companies under FDA's 21 CFR 820. It introduces the FDA's proposal to align with ISO 13485 for global standardization, addressing industry concerns about specific requirements and transition timelines. The FDA envisions integration to simplify processes and boost global trade. Although some organizations point out existing inconsistencies, this section concludes by introducing the study's application of Frederick W. Taylor's theories to systemically address challenges in aligning FDA's regulations with ISO 13485, emphasizing efficiency and a smooth transition. Statement of the research problem. The research problem revolves around the significant impact of transitioning from 21 CFR 820 to ISO 13485. Despite the FDA's intention to merge these regulations for efficiency, differences in their viewpoints pose complexities. Issues include distinctions in hiring practices, inspectors versus auditors, and contrasting focuses on complaint procedure. FDA, the broader input considerations, ISO. The dissertation aims to address this gap by investigating the concerns of 25 to 50 compliance directors through qualitative methods, offering a valuable insight to inform the FDA about potential challenges in this transition. The research also emphasizes the importance of public feedback in shaping FDA regulations, aiming to contribute to the creation of a reference map for navigating the future transition effectively. Purpose statement. The purpose of the study is to understand the concerns of quality and regulatory directors for medical device companies and manufacturers regarding this transition. Participants will be directors who have 20 plus years of experience within the U.S. Chapter 1 continued. Here are my research questions. I have 3 questions listed, as you can see. The significance of the problem. In this section, I highlight the significant concerns surrounding the transition from 21 CFR 820 to ISO 13485, emphasizing the need for transparency, efficiency, and effectiveness in the process. It discusses differences between ISO auditors and FDA inspectors, particularly regarding confidentiality and public disclosure of regulatory deficiencies. The study aims to address the identified gap by collecting concerns from various stakeholders and submitting them to the FDA for informed decision-making. Poorly executed transitions exemplified by past challenges in the FDA regulation realm can compromise public health and stifle innovation. The study's significance lies in enhancing accountability within public administration, focusing on measurable efficiency and effectiveness in the regulatory transition, with an emphasis on stakeholder participation and data-driven insights. Moving on to Chapter 2, a brief literature review. We're going to start with the agency's history and role. This section discusses the history and role of the Food and Drug Administration in the United States, highlighting its evolution from the early 20th century to its contemporary regulatory activities. The FDA's origins trace back to the 1906 Pure Food and Medications Act, marking the beginnings of its regulatory efforts to ensure the safety of food and drugs in the interstate commerce. The 1938 Food and Drug Cosmetic Act solidified the FDA's authority, introducing new regulations, safety measures, and increased enforcement capabilities. This section further details the Code of Federal Regulations, particularly Title 21. which contains rules related to medical devices. It explains the FDA's role in inspecting and regulating the medical devices manufacturers, emphasizing the importance of compliance with quality standards. Additionally, the section also introduces the International Organization for Standardization, ISO, providing insights into its establishment structure and collaboration with organizations like the American National Standards Institution. ISO's role in developing international standard is highlighted, including its impact on medical device companies seeking certification, particularly ISO 13485, for selling products in the European Union. The process of ISO 13485 certification audits and the significance of the CE mark for European market access are also discussed. Overall, this section outlines the historical context and regulatory framework governing food, drugs, and medical devices within the U.S., as well as international standards influencing the industry. Standards, background, and purpose. The purpose of 21 CFR 820, introduced by the FDA, establishes regulations to ensure the reliable and secure manufacture of medical devices in the U.S. The regulation, implemented in 1997, outlines 15 subparts focusing on various aspects of device manufacturing, emphasizing a flexible approach for manufacturers to establish and adhere to quality systems. Compliance is crucial for companies producing finished medical devices for commercial distribution within the U.S. The purpose of ISO 13485, published by the International Organization for Standardization, sets requirements for quality management systems, especially for companies that have intention to market their medical devices in international markets like Europe or Canada. Some of the problems are listed in this section. The proposed regulation, if finalized, will remain 21 CFR Part 820 as a quality management system regulation, aligning U.S. practices with global norms and saving medical device companies significant compliance costs. The FDA anticipates a cost reduction of $439 to $533 million over 10 years, aiming to simplify regulations and improve patient access to new medical devices. However, the Regulatory Affairs Professional Society, RAPS, notes inconsistencies between FDA and ISO standards and regulatory framework. Current data highlights a current absence of information on the concerns of medical device directors for the current transition. This emphasizes the need to address potential gaps and ensure transparency, accountability, efficiency, and effectiveness. This study aims to gather input from QARA directors to comprehensively understand the impact of FDA to ISO transition. The importance of pillars in public administration. If the FDA lacks 100% transparency, it will compromise accountability, which is a fundamental principle in public administration, synonymous with answerability, blameworthiness, and ethical standards. Accountability constituting a stewardship commitment to democracy, ethical ideals, and transparent legal demands serves as the foundation for ethical behavior and effective regulation, aligning public administration with good governance ideals. In summary, the FDA strategy for incorporating ISO 13485 by reference instead of rewriting 21 CFR 820 is highlighted in the conclusion, focusing ISO 13485 standard with the consideration for future updates. Discrepancies between 21 CFR 820 and ISO 13485 standards are noted, including differences in personal roles, rule adherence, and procedural focus, with the FDA intending to address inconsistencies by superseding conflicting terms and definitions of ISO 13485 with its own. Continued Chapter 2. Theory and Theorists Used. Frederick W. Taylor's theory of scientific management, introduced in 1909, prioritizes optimizing work processes for enhanced efficiency by breaking down complex tasks, observing and timing each component, and redesigning processes. Initially applied to blue-collar roles, Taylorism's principles prove versatile and applicable to administrative settings to simplify processes and boost overall efficiency. In the context of aligning FDA's 21 CFR 820 and ISO 13485, Taylorism is leveraged to minimize discrepancies and enhance efficiency during the transition of medical device standards. This qualitative study, framed by a deontological approach to science and accountability, underscores the significance of Taylorism in establishing transparent, efficient, and ethically aligned regulatory frameworks, promoting systemic evolution, accountability, and contributing to the good governance in public administration. Finally, Chapter 3, Research Design, Population, and Sample. This section of the paper outlines the dissertation's methodology, aiming to address the gap in the transition by gathering input from 20 to 50 compliance directors. The importance of compliance directors' input lies in identifying potential issues, ensuring practicality and feasibility, and enhancing effectiveness. The research design involves a qualitative approach, including semi-structured interviews and thematic analysis to explore challenges and benefits. The population consists of members from the Regulatory Affairs Professional Society, RAPS, and the sample selection criteria focus on QARA directors with 10 to 25 years of experience within the U.S. Chapter 3 continued. Instrumentation and data collection and data analysis. This chapter outlines the research methodology for the dissertation. It discusses the instrumentation, data collection process, and data analysis methods. The instrumentation involves utilizing an online post on the RAPS regulatory open forum with a link to assess candidate eligibility and subsequent one-on-one Zoom interviews. The data collection process includes qualitative research through open-ended, semi-structured interviews with key stakeholders in the medical device sector, ensuring a flexible yet systemic approach. The data analysis follows Creswell's 5 qualitative approaches to inquiry, focusing on organizing, reviewing, coding, revising, and presenting themes derived from the concerns of compliance directors regarding the transition. Last section of Chapter 3, Limitations and Conclusion. Possible limitations of the study arise from the selected methodology, posing challenges in maintaining rigor, assessing, and demonstrating it. The extensive data volume may prolong the analysis and interpretation process. Other constraints involve population size, classification, and organizational aspects, particularly within the global online setting. The study's exclusive focus on U.S. compliance directors within the U.S. may exclude a significant portion of the population, and participants' willingness could be hindered by the factors like stigma, obstacles, or misconception. In conclusion, the dissertation aims to bridge the gap in understanding compliance directors' perspectives on the transition from 21 CFR Part 820 to ISO 13485 within the realm of public administration. The study helps emphasize the potential benefits, challenges, and inconsistencies between FDA and ISO standards, aligning with the principles of transparency and accountability in regulatory practices, using a well-structured qualitative research design and the incorporation of Taylorism principles. Overall, the study seeks to provide valuable insights that can confirm or inform the FDA about potential challenges and contribute to the development of more effective and harmonized regulatory framework in the public health sector. For the Lord gives wisdom, from his mouth comes knowledge and understanding. Proverbs 2:6. This verse underscores the importance of wisdom, knowledge, and understanding, which can be applied to various aspects of decision-making, including regulatory framework and public administration. Thank you so much for your time, and God bless.